other one which I wanted to probably ask at this time, you mentioned about test, how many days, you mentioned 4 days and something. I just wanted a sense, what is the US practice? Because in India, as far as I understand, and I may be totally wrong about this, for those who are recovering post-COVID, under the ICMR norms, there's no mandate for testing, for a corona negative testing. So question, what is US doing, and should this corona negative testing be mandatory before a person who is or was corona positive moves out from isolation?
Okay, that's a good question, Ij, and we are struggling with this as well. So if you mind, I'll just go over the natural progression of the disease, because some of these chat questions are alluding to that as well. So for example, suppose I come in contact with a close friend who is COVID positive and unknowingly get the transmission of infection. For the first 5 or 6 days, I will have no symptoms. The average duration of symptom onset from exposure is 5 days. It can happen between day 1 and day 14, but the average is 5 days. After 5 days, I'll have an infection, and I would test positive if I was truly infected. My symptoms would last in moderation for the first 6 to 7 days. And if I was to get really sick, it would happen on week 2. So on day 12 to day 14 is when, if I was to get sick, I would get really sick and possibly get admitted or possibly go into the ICU. The recovery phase can depend a lot, depending on how healthy the person was to start with and how much of an inoculum dose the person has got. So if someone has sneezed in my face and I've received a lot of virus particles, I'm bound to be more sick. If I've just walked through a person who's been there, the amount of virus that I've been exposed to has a lot to do with how sick I'm going to get. The CDC guidelines here say that between day 10 and day 20, you can lift all precautions. However, in the ICU, where people are much sicker, we are doing a second test before we lift precautions, just because we think that people who are sicker can harbor the virus particles for a longer duration of time. So if you're at home and you're not very sick, after around 14 days, you do not really need a negative test to lift all precautions. However, if you're in the hospital or God forbid in the ICU, you should ask for a second test before you lift all precautions.